The marriage of healthcare and technology going well beyond wearables and virtual doctor visits. Coming up, using big data to treat disease. We'll take a closer look straight ahead. The cross-section of healthcare and technology is a theme we've been watching and certainly covering on Opening Bell. President Obama recently introducing a $215 million plan focused on precision medicine, using big data to treat illnesses. My next guest says more has to be done. Joining me right now is Niven Narain. He is co-founder, chief technology officer, and president of Berg Health. Good to see you, sir. Thank you so much for joining us.
Thank you for having me.
First, let's talk about precision healthcare and what the president was talking about here and how Berg goes even deeper than that.
Yeah, so the real definition of precision medicine is getting the right treatment to the right patient at the right time. And the president's initiative is a great start in that it sensitizes the industry towards producing drugs that is a better fit to the patient. However, the initiative is initially only going to be focused on genes, on looking at genomics. But at Berg, we go much deeper than genomics in that we're looking at the entire patient profile, the full narrative of the patient, if you will. So, much like buying a home, you want to get all the data around that home, the demographics, et cetera. So in producing the best drugs that is the best fit for patients, you want to get all those data points and not just look at one slice in time.
How are you coming up with the medicines to identify the health issues? I mean, you say you have a lot of data. The cost of genomics we know has come way down.
Yes.
So you've got the DNA of the person. Is that all you need? What is the other information that you're gathering? So
at Berg, we actually start off by taking tissue samples. For example, breast cancer, for example. We look at tissue samples from women with breast cancer. We do look at the DNA, but we look at the patient's overall proteins and lipids, metabolites. We look at that patient's clinical data. And then we take all of this information and let an artificial intelligence analytic system make sense of the data, because there's a lot of talk about big data in medicine, but one of the issues is that it's really easy to create all of that data. But at Berg, we use the AI to help us make sense of all the patient's information and data, so that we're actually finding the areas in the biology that's gone wrong and producing drugs based on that, instead of the traditional mode, which is to screen chemicals, and whichever chemicals hits a drug target, that becomes a drug. So our model is actually flipping everything upside down and putting the biology at the front end with the AI to help us make sense of all the data.
Because AI, or machines, basically machine learning can digest and analyze information a lot faster than a human can.
Absolutely, absolutely. And I mean, just on one of the samples we use, Maria, we create on average over 14 trillion data points. So if you think about it, the human brain just, there's no way that our brain is going to process that data. So we really need the futuristic medicine, which I used to say is a few years away. I think we're there right now. And the AI helps to make sense of that data, so it's more actionable data. It's not just big data.
And of course, whether it's Berg Health or really this whole revolution going on with technology and the marriage of tech and healthcare, we're living longer.
We are.
I mean, longevity is one of the great ends to this story.
That's right.
What do you think the lifetime will be for an American within the next 10 years?
I think that if you look back in history at where we've come from, in the 50s, the life expectancy used to be in the 70s. We're now comfortably in the 80s. I think in the next 10 years, we're easily going to be in the 90s and beyond. And it's not only the quantity of life, but we're getting to a point where we're also going to enjoy a quality of life. If you look at all the wearable technologies that you have now with the Fitbits that are mapping your heart rate and your sleeping patterns, etc., we're learning more about ourselves in real time. And because of technology, we're able to appreciate what are the things that we can do more effectively to take control of our health.
Which is why we're getting in front of disease. It's really extraordinary. And by the way, Craig Venter, who of course mapped the genome, told me a couple of weeks ago, in the next 10 years, we will be living into our second century. So it's just extraordinary stuff. And Niven, good to have you on the program.
Yes. Thank you so much.
Thank you so much for joining us. Niven is joining us from Berg Health, talking about how you're getting ahead of disease as well at Berg. We'll see you soon, sir. Thank you so much.